Welcome to Evergreen Family Medicine. Today we're with Dr. David Patterson, provider at Evergreen. Welcome.
Hi.
And welcome to Roseburg, a recent transplant here, I understand.
Yes, thank you very much. We're happy to be here.
Tell me about your path to coming to Evergreen.
Well, I did my residency training in Louisville, Kentucky. I did my med school there in residency, and then decided to come out here and have really enjoyed the area.
So you're from Louisville?
From Central Kentucky.
So I said it wrong. Louisville. It's Louisville.
Correct.
Right?
Louisville.
Is that better? Okay.
Louisville.
All right. Good. Now you can't say Willamette Valley.
Right.
Okay. We're even. All right. Fantastic. So tell us about your family. I understand you have little kids.
I do. I have two children, boys. Parker is 4 and Elliot is 2. And they're both wonderful to be around.
Tell us about your wife too. Don't leave her out.
Right. My wife is Brittany. Yeah, and we've been married for almost 8 years.
Great. Congratulations. So tell us about the path to Roseburg. What brought you to Evergreen?
Well, I was looking for a job that would really suit my needs. I'm very family oriented, and I wanted something that was challenging and would be very fulfilling. So I scoured literally the country for a job, and I just, whether it by chance or by fate, found Evergreen and talked with Dr. Powell and really fell in love with what he had to say, and it was very unique.
Yeah, we hear that a lot from people who find Evergreen and see something special or a little different, or the combination of the location being here in Roseburg and the support potentially you get from people like the Powells is pretty remarkable. Nice combination, I think a lot of people find. But what I want to know too is what your early impressions are of Evergreen. So you've been working there now for about 6 months. And by the time you've been through school and residency, you've seen some things, you've been around a little bit. I think you get a good sense of what you want. So early impressions of Evergreen from you.
It has been great. And the people there are very friendly. All the staff have been very helpful. Any needs that I have, they're quick to answer them and address them. And I really don't have too much to ask for because it's already there for me to do all the tools that I need.
That's great. So what's it like coming out of residency and then going into being a provider?
Well, it's definitely been a nice transition. The busy life of being a resident and how hard that is and the long hours and the call nights. I'm definitely happy to leave that behind. And kind of settle into more of a family lifestyle while being able to practice independently on my own and provide the care that I want to do without too much oversight within reason.
Do you have an area of, I don't want to say expertise or focus, but a favorite thing about being a provider or being a doctor?
I have always really enjoyed working with children. That's been a great passion of mine. I have 2 of my own. And in Louisville, we had the benefit of having one of the largest pediatric hospitals in that region. So we had a lot of good training there and a lot of good exposure. And additionally, I also really enjoy mental health. So that's something that's been a passion of mine, dealing with anxiety, depression, and just really treating or not overlooking that aspect of a person's health.
We've had conversations about mental health in this pandemic time in COVID and the impacts and things that you don't even realize maybe that you're dealing with on almost a subconscious level. Any thoughts on that? It's
definitely been for the past 2 years this underlying calm panic mode that people have had, and people have been struggling in every aspect of their life. And any type of assistance that I can give in the realm of mental health, I'm more than happy to do.
What's another aspect of being a provider that you enjoy the most?
One thing that I've always enjoyed, both in residency and here at Evergreen, is getting to know the person, not just as a patient, but as an individual, and really sometimes as a family, and knowing and understanding what it is that they need and listening to what they have to say, and just being very welcoming and not rushing through something.
That personal touch, that personal attention takes time. How do you manage that in the middle of a busy day?
First thing that I like to do is just ask the patient, how can I help you? What's going on today? And I reiterate that all through the visit. What other questions do you have? What other needs do you have? Do you feel like I have fully answered all of your questions? Do you feel satisfied with this visit? And if they don't, they'll let me know. And I give them several opportunities to say so. In addition, if I feel that we're running very over time, I'm always happy to say, I'm more than happy to continue this conversation. We can follow up rather over the phone, maybe a telemedicine visit, or in a week, or whatever works in your schedule.
It's good to hear that and to understand sometimes the work that goes into that personal touch and being the kind of doctor that I think everybody wants. Everybody wants to be heard, and they all want that time with their provider. So to be able to understand that a little bit is really good. And we often do say as well, and in fact, there's another video on this YouTube channel that talks about attention to detail and the amount of care, and the fact that if you have to wait a little while, it's because we're giving that level of care to other people as well, the same as you would want. And so I know that ends up being a customer service kind of conversation for sure. So, but it sounds like the kind of thing that motivates you and that you enjoy the most.
One thing that I always am mindful of is that we have patients not just here in Roseburg, but people who drive 1 or 2 hours away. We have people who come from the coast, and they're taking their whole day to come see me for maybe a 20-minute visit. And so I want to make sure that they're getting what they feel they've put into this, and they feel satisfied afterwards.
Well, Dr. Patterson, thank you so much for the time and the introduction. And again, welcome to Roseburg.
Great. Thank you for having me.
Dr. David Patterson, one of our providers at Evergreen Family Medicine. You can learn more about all the providers and see what's happening at Evergreen all the time at evergreenfamilymedicine.com, and follow us on YouTube, Facebook, Twitter, and Instagram.